Bag technique and hand hygiene are the first lines of defense against infection. Not only is bag technique part of standard precautions, but it also shows the patient and their family that you are a conscientious professional. Taking care of your supplies demonstrates the pride you have in your work. The care you provide does not limit itself to direct patient care. It is in the way you present yourself in the patient's home. There are clean and dirty areas of the bag. Dirty areas are those that you may enter without first performing hand hygiene. If you enter the dirty areas of the bag during patient care, you must perform hand hygiene before resuming care on the patient. Do not enter the clean sections of the bag without first performing hand hygiene. This section is considered a dirty area, as you would have to place a dirty hand in it to grab clean supplies, like paper towels, barriers, and antibacterial soap. This is also considered a dirty compartment. It contains agency-approved disinfecting wipes and antibacterial hand gel. This compartment should contain minimal supplies and hold patient information that you use for each patient visit. Your main compartment will contain your equipment used to take vitals, gloves, and clean gauze for cleaning wounds. All these items should be kept separate from each other. Your bag should never be stuffed or overfilled. Major supplies should be left in the trunk and pulled from on a patient-by-patient basis. Minimal supplies should be kept in your bag so that they may be discarded if contaminated. Perform hand hygiene before entering the patient's home. Rub hands vigorously together, causing persistent friction between fingers, around fingernails, the back of the hands, wrists, and palms until dry. You must wash hands with soap and water if your hands are visibly soiled, they feel sticky, or if patient has undiagnosed diarrhea, C. diff, or other spore-producing infections. Do not take your bag into the patient's home if it is very dirty, infested, or if the patient has C. diff, other spore-producing infections, or has undiagnosed diarrhea. A contact precautions kit must be used and supplies should be left in the patient's home. Place a barrier under your bag. Do not place non-rolling bag on floor. Create a clean and a dirty field by placing two barriers next to your bag. Zip bag closed when not in use. Place supplies used to take vitals onto your clean field. Remember, these items are clean from the last time you used them. Place hand sanitizer gel and agency-approved disinfecting wipes on the dirty field. After performing patient care, use hand sanitizing gel before cleaning equipment. Use agency-approved disinfecting wipes to clean equipment from areas of clean to dirty. For instance, begin cleaning the stethoscope with the cleanest area, which are the earpieces. Work your way down and finish with the dirtiest piece, which is the bell that touched the patient. After cleaning your supplies, place on your clean field and allow time for drying. Never enter your bag with a gloved hand. Take off your glove and perform hand hygiene before going back into bag. Collect barriers and place in the patient's trash receptacle. The exterior of your bag is considered dirty and should be kept in a separate compartment in your trunk, away from the clean supplies. The exterior of the bag should be cleaned with an agency-approved disinfecting wipe if thought to be soiled. Just as you would gel in and out from a hospital room, you must gel in and gel out from your nursing bag. Remember, bag technique is not limited to your nursing bag. Your biohazard cooler follows the same rules. The interior of this bag is always dirty, so please, no clean supplies should be placed inside. If a laptop is brought into the home, place on a barrier. Hand hygiene is performed before touching the keyboard. Use agency-approved disinfecting wipe to wipe down keyboard after use. You will now have the opportunity to demonstrate what you just learned. On behalf of National Home Health, thank you for watching.